Complications of blepharoplasty. Blepharoplasty or eyelid surgery is a very rewarding procedure, but unfortunately, like any other surgery, carries certain risks. There are many risks and we can't go over all the possible complications, but here are a few that we need to be aware. The most devastating complication can be blindness. Blindness has never been reported in the upper eyelid surgery that I'm aware of. It has been reported in the lower eyelid surgery with an incidence of about 0.04%. And it happens because of bleeding typically. Bleeding after surgery that squeezes the eyeball and the optic nerve and it can affect it and kill it. That's at least one of the theories. And that's why it's very important to make sure you're off all the blood thinners and you're not doing any heavy exercise afterward, and you're working with surgeon to follow all the instructions to the T. Then come other issues such as double vision. Injury to a muscle of the eye can lead to double vision. Majority of the time, this is temporary trauma and gets better. In rare cases, it might be permanent and might require surgery to fix the damage to that muscle and restore the vision to single vision. There can be dry eyes after surgery. In a lot of cases, there's some dryness already, but then the surgery throws it over the edge and now your eyes are very dry and you become dependent on eye drops. You can lose your eyelashes, minor complication, but they do grow back. You can have asymmetry between both sides, which can be significant and might need to be corrected. Rarely you can have perforation of your globe. When you're getting the injection, the needle by mistake can go into the eye and cause injury, and that becomes an emergency that needs immediate treatment by an ophthalmologist. You can have scar formation that pulls the eyelid, especially the lower eyelid, outwards, called ectropion, and that needs to be fixed with canthoplasty, which is a term of tightening the side to bring it back to where it belongs. In rare cases, you need a graft of some kind to build up the area where there's scar tissue. You can have inability to close the eyes completely as well. That happens from removing too much eyelid skin, and if that happens, you need skin grafts or something to be able to close the eyes again. Rarely you can have a change in your prescription glasses or develop astigmatism as well. Not a very common thing though. In some cases, you can notice a change in the color of the eyelid skin, and it can look more reddish, and there's really nothing you can do to prevent it. It's just the way the healing process goes in some cases, and you can treat it later on with some lasers, but not very effectively. Along with the change in the color of the skin, you can also have a prolonged swelling of the eyelid skin, which can take weeks to go away, in some cases even months. You can also have chemosis, which is the swelling of the white part of your eye, the sclera. The lining covering it gets swollen. It's called chemosis, and that can take a very long time to go away. You can develop photosensitivity to the light and make it difficult for you to be out for a while, and just generalized sense of itching or pain, or you can have prolonged bruising in the skin as well. Those are only a few of the complications. The good thing is majority of those are easily correctable. And the main one to worry about is blindness, and the way to prevent is to go to a surgeon who knows about it, who's openly talking about it, and you're willing to follow all the instructions and work as a team to prevent that. Other than that, it's a rewarding procedure. Enjoy it. Thank you. Thank you for watching the video. I hope you liked it. I love doing these videos and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also, we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.